What is HealthSpan, and why does it matter more than ever? Well, I'm Dr. Mike Wall, and I recently had the privilege of attending the Global HealthSpan Summit in Riyadh, an event hosted by Hevolution, a foundation dedicated to advancing the science of healthy aging and ensuring that we not only live longer, but we live better. Today, I'm joined by Dr. John Beard, the director of the International Longevity Center at Columbia University and the former director of Aging and Life course at the World Health Organization. With decades of experience shaping global practices on aging, Dr. Beard has played a crucial role in developing the framework for healthy aging that influences how we approach longevity today. In our conversation, we'll discuss why the term health span can be misleading. We'll talk about the role of lifelong habits in shaping how we age and the changes we need in medicine and society to better support people as they grow older. From the power of physical activity to the role of technology and AI in tracking health, we'll explore the shifts needed to redefine aging, moving beyond disease prevention and fostering long-term functional ability. So let's get to our conversation with Dr. Beard. Dr. Beard, thanks for being on the show.
Great to be here.
Yeah, well, listen, for our audience, we're at the Global HealthSpan Conference right now. You're a speaker, you're a researcher, you've got an extensive career. Why don't you give us a bit of background on yourself?
Okay, so I'm currently the director of the International Longevity Center at Columbia University. I was previously the director of Aging and Life course for the World Health Organization for 10 years, where we developed a global roadmap for healthy aging and basically stuck our noses everywhere.
Fantastic. Well, that's what we're going to talk about. We're going to cover a full spectrum of different things today. But I think one of the questions people have is there's still a confusion that exists between what lifespan is and what health span is. You care to elaborate that?
I think it's unfortunate that we use this term health span, actually, because it's quite different in nature from lifespan. Lifespan is pretty clear. You're alive or you're dead. We know how long people live, and it's a black and white event. But health isn't black and white. Health is much more nuanced than that. And one person can say they're healthy, and another person in the same state may think that they're not healthy. So we need to have a more nuanced perspective on it. And another problem at the moment is when we talk about health span, people tend to think of disease-free span. Mm-hmm. And what we're learning with aging is even if people don't get diseases, they still get old. You know, like we're all aging every day. Mm-hmm. And it's just that as we age, our risk of all chronic diseases increases. So we tend to look at them as the problem. But what we need to be thinking about are the fundamental changes that are occurring underneath that increase in risk. And those changes also drive this gradual decline we experience across our lives.
Well, that's the thing. I think that, people do associate aging with almost every condition we have. And depending on who we are, what our genetics are, what our lifestyle is, where we live, these diseases manifest in different ways. How important is it for somebody to maintain this health as they age? Like, is it bigger than just having a bad doctor's appointment?
Oh, yeah. I mean, and it's a life course thing.
Yeah.
The health we experience in older age is determined by things that happened across our lives, starting even probably before we were born. Right. And our experience in the womb, the mother's nutrition and so on, then very heavily influenced by things like education and nutrition as we were children, the habits we developed, and then going through, the behaviors we have across our lives and the environments we inhabit and the impact they have. So all of that adds up, and then it's mixed in with each of us are individuals, and our genes are all different. So what comes out at the end is fairly unpredictable and complex, and it is the outcome of a complex system.
So you just listed a ton of different factors that can impact us. What would be the ones that you would, if people were listening, they were like, what are the biggest factors that you've seen in your work that contribute to this healthier lifespan or this period of longevity where you're living well?
Well, I mean, I think a lot of them are outside our control because they occurred earlier in our life. But education and nutrition early in life is absolutely critical. But as you age, there are things that you could do which are going to impact the trajectory of aging that you experience. And I think physical activity is probably the most crucial one. It interests people because it's not necessarily as you get older, you need to be a bit more careful with your physical activity. things like resistance training and building muscle mass and strength actually become more important as you get older rather than younger. So we need to be thinking about that in a very flexible way, and not necessarily thinking that 10,000 steps a day, that's what I need to do. I have to keep doing that. It changes as we age.
And I feel like people think of aging only as we get older. But you just said yourself, from the second we're born, we're in the womb, we start aging. We're constantly aging. It's a race we're in since the second we're born. I've recently gone through this myself. I was in the wellness world for a long time, and I've had to reassess how I maintain my physical health as I'm middle-aged as opposed to when I was 20. How often should people be reflecting on what they're doing and adapting as they go longer in life?
I think it's a continual process. I think one of the problems at the moment, though, is that we have these rather outdated ways of thinking about our health. As I spoke about at the beginning, that we tend to think if you don't have a disease, you're healthy. But in fact, that's not the case. And the problem is we don't have ways currently of monitoring that in a continuous way. I mean, look, I'm 69. I know when in my 50s, 60s, I started looking around. I was wondering, how am I going in terms of my health? Am I better than average, worse than average? And what's the trajectory I'm following? Is that average or, I couldn't find the answer to that, but we probably have the data, but we don't yet process it in a way that's meaningful to people like me. And, you should be able to monitor that. And with children, we're really used to pediatricians when we go and take our child into the doctor. The doctor measures their height, their growth, their development. They're not, yes, they're scanning for disease, but what gets them concerned is if we're not growing as quickly as we should be. We should be able to do the same thing in the second half of life and say, well, actually, you're declining quicker than you should be. Now, what are the reasons? And then try and intervene to do something about it.
Do you think that's a problem with the medical system, though, because they're comparing you to some standardized measure, saying you're not sick yet, come back when you're diabetic, when your cholesterol is high, as opposed to comparing somebody to themselves and saying your rate of decline is significantly faster or less than it was before?
Absolutely. And it comes back to this categorical way that doctors, and I can say this because I'm a doctor, that doctors tend to think that you either have a disease or you don't. And if you have the disease, you need this treatment. So it's all very black and white. But there was a whole process that led to you developing that disease. And we should be looking much, much earlier about, what are the interventions we should be doing to try and influence that process, not waiting till somebody comes up with the ultimate symptoms.
Well, you're at the university setting. I teach university. I teach first and second year physiology and some lifestyle aspects of it. But what do you think we should be incorporating or changing in how our physicians practice with individuals, especially as our populations tend to be getting older in the West?
Well, my own take is a focus on functioning and whether people can maintain their functioning and if they can slow the decline to something better than the population norm. So we look at locomotor capacity. We look at cognitive capacity, sensory capacity, and psychological capacity. And there's a few others as well, but they're the core ones. I think we should be able to monitor them continuously. Our locomotor capacity, how fast we're walking, how strong our muscles are, how our balance is going. We need to be monitoring our vision continually and looking at how it's changing. Having done that and looked at those outcomes, which are really the outcomes that are of most importance to somebody, it's what determines whether you can be the things that you want to be. We can then start looking at the biological measures, what's called biomarkers, which actually tell us about early change in each of those domains. But we're only just on the cusp of being able to do that. But we should be able to monitor our biomarkers, and that will tell us, listen, this means that in 10 years' time, your locomotor capacity is going to be declining faster than average, and we need to do something about it.
So is this where technology is going to play a role? Are things like AI and the ability to analyze large amounts of data or have wearable devices, are these things that will actually be able to change the way we treat people as we all age?
Yeah, I think we're currently, if we can break down these rigid thinking paradigms, then there's two other changes which mean we're really on the tipping point for a completely new world. One is we have so much extra data than we ever had, and it could be collected by your mobile phone. My mobile phone tells me my gait speed. It's a really crucial predictor. So, and it's already collected. Most people don't look at it, but it's there. There's data that's collected when you visit a doctor and you have tests. There could be all sorts of other data from wearable devices. Anyway, there's all this data which is coming in. And in the past, we've never been able to manage that because it's overload. There's just too much. With AI, we can actually not only start to interpret that, but start to fill the gaps and start to join things which we haven't been joined in the past. And so we can come up with, a much clearer picture on what's actually going on. I like to think of it that up until now, we have the best humans have been able to do in terms of grappling with this very complex thing of health and aging is to think of it through these narrow boxes of disease and not disease. The trouble now is, even though we have all these advantages, we're stuck with those boxes. If we sweep the boxes away, for the first time, we actually may be able to look directly at people's health and think about what that is and how we can intervene to influence it. So I think it's a really exciting time. I think we're at the point where it's all going to change, but we're not there yet.
So the question would be, do you think there has to be drastic changes in how we train our physicians? Are they equipped to be able to treat patients this way if they've been trained in this sort of black or white model, sick or not sick? Do they have the time, the capacity, or the ability to be able to address these concerns? Right?
No, not at all. Again, I'm a doctor. I can say this, and I was trained many years ago. Maybe it's a little bit different now, but yeah, we are trained to detect abnormalities. We're not trained to detect change. Yep. And the other thing is, even when doctors talk about prevention, they're talking about prevention of disease, and they think about it in a very linear and disaggregated way. So you think about heart disease, prevention of heart disease, smoking, and there's a straight line. Mm-hmm. But smoking actually drives all sorts of different changes. Smoking's an obvious one, but so does physical activity and our exposure to infectious disease in the past. So when people talk about heart disease, to me, it doesn't even make sense. What is heart disease? All it is the ultimate manifestation of a whole lot of underlying changes, which actually, in this person at that point in time, are being expressed as heart disease. Yep. But if I treat the heart disease, they're going to become expressed in a different way, arthritis or dementia or whatever. Yep. They're all driven by the same underlying determinants. Yep. And we need to be looking at those underlying determinants and trying to understand what influences them, not waiting to manage the problem as it arises.
I couldn't agree with you more. I used to say that our genetics or the way we were built is like a chain, and you put stress in that chain, some links will snap in you, some will snap in me. They snap in different ways. Well, if you weld one chain link, another one's going to snap on this because the stress is still underlying it. And so we talked about the medical system and sort of the changes that can occur. What about communities? Because you've been involved with the World Health Organization. How does our environment impact it? And what do we have to start doing to build communities to be conducive to promoting health?
Okay, so there's two ways that the environment influences our health and our aging. The first one is it influences our behaviors, our decisions, our nutrition, all of those sorts of things, and the environmental exposures we have every day. Mm-hmm. And those things can ultimately add up to influencing these trajectories of aging. But the other way that the environment operates is, given our state at any one point on one particular day, what I can do is also influenced by the context, by where I live. So, the reason I left the World Health Organization was because I hit their mandatory retirement age, right? So a rule meant that I couldn't do what I wanted to do, So there's a very stark example of how the environment can influence our well-being ultimately. Yeah. But the environment, if you think in terms of the assistive devices, the technology that's available now, the provision of things like disabled access public transport, all of these things really determine our experience of aging, regardless of what went before. So that you've got the environment operates in these two ways. How do you address that? Well, there's big policy decisions that you can make. one of the great initiatives we developed at WHO is the Global Network of Age-Friendly Cities and Communities, which now covers over 300 million people. And each of those municipalities has committed to trying to become a better place in which to age. So it will provide better environments that support people who want to be physically active, but also provide street seating so that older people who may be becoming frail are still happy to go out because they can sit down or they can access a toilet or very practical issues like that. So we can tackle it from that political decision-making level. But there are also really neat community-based initiatives in Asia and parts of Africa. There are initiatives called Older People's Associations, and they are basically groups which bring together older people in the community, and many of these are very impoverished, poor, remote communities. And they bring together older people, but they may also involve younger people. So it might be that some of them are called intergenerational communities. But the idea is they help those people maintain health. So they give them the skills to do health promotion, have group exercise activities. They screen them for their health status at the moment. If they've got high blood pressure, they send them to the appropriate clinician. They can provide microcredits so that they can put in place create small businesses to maintain their financial security. So, and in doing that, they actually strengthen the human capital that's inherent in older populations, but which we often don't draw on. And that human capital can then be targeted to support other older people, frail older people who need care and support. But it can also be targeted for broader support in the community. And an example I just gave in a talk I gave was in the Irrawaddy Delta in Myanmar. I visited a village where there was an older people's association. And when they were created, they invested the resources they had into creating a rice bank. And they'd sell rice and eventually they made a profit. And with that profit, they connected the village to electricity. And so there you have the inherent capital of older populations being enabled and reinforced, and the return on that investment is a benefit to everybody.
It's interesting. I was in Okinawa and I went out with a gardening group, loosely translated to gardening with old guys. Some of these guys have been friends for over 90 years. There was 98-year-olds in the group. And what they did was they were retired, but they wanted to have purpose. So they gave them the gardening tools. They went around and they had so much time to put into it. The community, first of all, they were celebrities because they would stop. But then they would graft lilies into trees, and the lilies were so beautiful. They would sell them and they would raise money for the kids' sports program, intergenerational support. And I think that one of the things that we have in Western society is this almost discard sometimes of people, like they don't have usefulness as they get older. You just talked about the capital we have here. How do we have to shift our attitudes and how we see these important people in our society that have all this knowledge and this experience?
Okay, so what you're touching on there is ageism. And ageism is very pervasive across society. We have these stereotypes which probably developed when we were children. So we tend to reinvent the past, and those stereotypes are that older people are frail and a burden, an economic burden on society. And then we create the structures that basically reinforce those stereotypes, and they become self-reinforcing. And further, what we tend to do is internalize those stereotypes. And so we start to think about inside, we have these expectations of what a normal older person does. I remember when I took up this job at Columbia University, I said to myself, should I really be doing this at my age?
Yeah.
And I was the director of aging at WHO. I'd have to be aware of this. But, I heard these internal voices. Yeah. Why would I ask myself? And I'd just been offered, one of the best gigs on the planet. And I'm asking myself, should I be doing it because I'm too old? So ageism is really important, and it influences not just ourselves, but it influences employer practices. It influences, as you say, the way that society treats you as a person. They look at you, they put you in a box as an older person, and then they treat you as they think an older person should be treated. So, yeah, we need to break all that down, but that's a hard road to hoe, I'm afraid.
Yeah. And I think for people listening, obviously, you've got a tremendous amount of energy. I would never in a million years, first of all, guess your age, but secondly, think that you wouldn't be able to continue on doing anything you want. And I think that we do this to ourselves as well. What message would you have to people to say, like, to not slow down necessarily? Maybe we think we're supposed to, but is that necessarily, that's not a good thing?
Well, sometimes I look at my midlife and I think, yeah, I should have slowed down earlier, but I think the idea of work-life balance and trying to find meaning in your life and, really committing to living what you want to be and what you should be is really important. I mean, another thing that I've found personally really helpful is meditation, and taking the time out to actually think what it is that I want to do and then making it happen. When with due respect, I was your age, you really think you're going to live forever. You don't get it, that there is a horizon. When you get to my age, you realize, okay, there really is a horizon. I'm going to die. And it actually seems to be getting closer, pretty quickly. And then you start thinking, well, if I've only got this amount of time, what am I going to do with it? And you start prioritizing better. And, so I think stepping back, taking the time to figure out what it is we want to do with our lives and actually respecting ourselves enough to prioritize that over all the other things that tend to dominate us, I think is important as well.
Well, we've talked about a lot of things today. We've talked about the community side of things. We've talked about the ability to be able to determine how we're aging and changing our entire healthcare system. For the people that are listening, though, what action items would you tell them? What would be the biggest piece of advice you'd have for anybody of any age that's listening to this and saying, okay, I'm realizing that HealthSpan is important. Like, what would you tell them to do?
Okay. Well, the first thing is it's never too late, to get people to understand that if you're a smoker, it's never too late to stop and the benefits accrue, if you're physically inactive, it's never too late to actually start being active and doing stuff. If you're already doing something, it's not too hard to change. It is hard to motivate ourselves to do that, but I think it's about self-respect and respecting, our value, and that takes an investment of our time. And that deserves an equal prioritization in our lives. So, step back, try and assess what's important to you, take the time, whether it's through meditation or whatever, to help you focus and find a way of managing stress. We're all going to experience stress, but we need to manage it in a way that's productive. And then just taking the little steps that might actually get you on the pathway to ultimately experiencing more profoundly positive aging. That's where I'd start.
That's so interesting, because I was in Norway last year and they have a philosophy called mestring. They don't want to go to a ski hill and take a chairlift and ski down. They want to have a bit of work, because when they accomplish something, it's worth it because they've put the investment in. I think that's really wise advice you just gave. Now, there's a question that I've asked every health expert anywhere in the world to put into their background, and I'm really curious to hear your response to this. And there's no right or wrong, but it's what does the word health mean to you?
Okay, when I was at WHO, we developed this framework for healthy aging, and we said healthy aging was the building and maintaining of the functional ability that enables us to be and do the things we value. So, I think that's how I think about health. It's, can I be and do the things that I value? It's not, I have high blood pressure. I take medication for it. That's not important to me. What's important is, can I still, go for a swim? And actually, I've moved from surfing to skiing. Can I still tackle that hill? And I have a 10-year-old son, we do it together. Those are the things that are important. And that's what health is, being able to keep doing.
Fantastic. Well, thank you so much for taking the time today. I found this is a very, very interesting conversation. It's such a nice one to talk about such a broad variety of things. I'm glad you're in the education system, and thanks for joining me.
It was a pleasure.
Well, that was Dr. Beard, and that's today's conversation, but we're just getting started. We have many more interviews with leading experts from the Global HealthSpan Summit, where the brightest minds in the field are redefining what it means to age well. I'm Dr. Mike Wall. Be sure to like and subscribe, because we'll be coming to you with more interviews from the Global HealthSpan Summit over the coming weeks.